Thank you, Dr. Sankar. It's my honor to be here, and I appreciate you giving me the time and opportunity to share my experience and my story. So again, my name is Lieutenant Aaron Banas. I'm an active duty Navy staff psychologist working primarily in health psychology. I agreed to speak here today because I thought it would be helpful to bring a patient's perspective of long COVID and related chronic pain. So I'm going to share the course of my illness, starting from when I contracted COVID and first started experiencing symptoms. And I'll also address the various treatments I received, what I found helpful, and the current symptoms I'm experiencing with a focus on chronic pain. So before I start, I talk about my course of COVID. Here's some basic background information about me to give you some context. So I'm a 37-year-old Hispanic male. I have a personal history of familial hypercholesterolemia, borderline low testosterone, and mild mid-back pain. Prior to the infection, I was in pretty good health. I ate healthy, I exercised daily. I had no difficulty accomplishing my various military duties. No tobacco use, occasional caffeine and alcohol. I was not on any medications at that time. So overall, I consider myself to be in pretty good health up until I contracted the virus. So I contracted COVID from a patient that I was working with in late March of 2020. So at that time, most patients had transitioned to telehealth, but I was still seeing a few high-risk cases in person. And the patient presented with pretty classic signs of and symptoms of COVID, but had refused to go get tested. Because of this, this was a high-risk patient. I felt obligated to complete the session. At the time, I thought I was taking some pretty strong precautions. I have a spouse who's immunocompromised, so I felt like I was pretty good with everything. I wore eye protection. I was wearing double masks before we were told to double mask. Um, I think I did everything that I could to potentially not get it, but um, despite my precautions, about a week later, I started developing symptoms. The initial symptoms were somewhat atypical for what we knew about COVID at the time. I was experiencing frequent urination, mild pain behind my eyes, and some very mild fatigue. Again, the fatigue is something that we associate, but at that time, it was just kind of these like non-specific symptoms, so I wasn't automatically thinking COVID. In about a week, this progressed to a low-grade fever, and probably the worst chills I've ever experienced with an illness before. I ended up going to the ER as a result, where a COVID test was conducted. I was monitored for the evening and sent home. Based upon my symptoms, even the ER doc wasn't really thinking COVID at the time, and actually suspected diabetes insipidus. And I was told that if my symptoms worsened, to return to the ER. So the next day, I developed abdominal pain and started vomiting, and so I returned to the ER. And on my way to the ER, I learned about I got a call about my positive COVID test. Upon getting to the ER, I received some IV fluids. It was monitored for several hours before I was released in quarantine, actually quarantined on base. One of the reasons why I was quarantined on base was because of the risk of family exposure, and I had been very, like I said, very careful with my family at the time. Unfortunately, they did not contract COVID. Um, so uh, within a few days of developing a fever, it was as if, I guess the best way I could describe it is as if my body started to go haywire. I had alternating bouts of diarrhea and constipation, frequent urination that resulted in electrolyte imbalance and multiple ER visits, sinus congestion, a cough, severe headaches, intense sleepiness that caused me to sleep 12 plus hours a day, ongoing chills and body aches. So kind of like these wide range of physical symptoms. Uh, um, my fever only lasted a few days, but really that was kind of only the beginning of things. After about a week or so, I developed COVID pneumonia and continued to feel worse. I experienced shortness of breath and had to be transported via ambulance to the hospital, where I received oxygen therapy. About 2 weeks into my illness, I was hospitalized for concern about the pneumonia and possibility of blood clots. I only ended up staying a couple days in the hospital. Um, Lab tests were kind of, they didn't really find a whole lot that they could say, and my condition was otherwise stable. Since there was so much unknown about the virus at the time, really not a whole lot was done in the way of treatment other than frequent ER visits whenever my condition took a turn for the worse, such as a dehydration. After about 4 weeks, I continued to test positive for COVID. My symptoms changed pretty dramatically. I went from sleeping about 12 plus hours a day to sleeping maybe an hour or two of broken sleep a night. It was like a switch was flipped in my brain, and I don't know if to this day I don't know if it was some sort of neuropathy that caused this, if it was some kind of acute stress reaction. Um, a neurologist I spoke with at the time, she's like, it's almost like you're going through a manic episode. But I've never, I'm being 37, I've never had a manic episode before. The likelihood of that, unless it was somehow a mood disorder caused by COVID, was highly unlikely. It was as if my symptom was in a state of constant hyperarousal, but cognitively I felt very dull. I started losing chunks of time and experienced periods of disorientation. I went from feeling perpetually sleepy to not feeling tired at all. I developed persistent and severe headaches that I was not able to gain any relief through pain relievers. Uh, I was evaluated by neurologists who suggested I was experiencing episodes of delirium. Was having a lot of cognitive difficulties, brain fog. My vision and hearing were affected with losses in both. I experienced pretty intense paresthesias in my head and face. I was also experiencing pretty intense heart palpitations that were particularly bad at night. So, those few brief moments that I did sleep, I was usually jolted awake from my heart pounding. I started seeing a psychiatric nurse practitioner and trialed a number of anxiety and sleep medications kind of throughout my illness, none of which really had any sort of effect. Uh, and about 5 weeks in, and here's kind of another oddity that happened. I completely lost my sense of taste and smell. So this is like 5 weeks into the illness, and I still kind of had these new symptoms appearing. And at this time, I was still in quarantine. I also developed a phantom smell that smelled, it almost smelled like something burning, like a smoke smell. And it started off like very intermittent and kind of, I guess, low grade, you could say. And I thought something was burning in my quarantine room, but eventually it became so bad. It was like my head was in a room full of smoke. And it continued to test positive for COVID until about week 7. I stayed an extra week in quarantine just to be safe, since I was still having all these crazy symptoms popping up. And around week 8, I was to be admitted for a neurological workup due to suspected seizures and kind of all these wide range of neuro symptoms that I was experiencing. However, I tested positive again twice on 2 separate COVID tests and was again placed in quarantine. I was admitted to a COVID unit to complete a partial neurological workup. I received a lumbar puncture, but wasn't able to get an EEG at the time. The lumbar puncture did not test for COVID in my CSF, but did not find any other major abnormalities. Due to the neurological symptoms, I was treated empirically for seizures with carbamazepine. And I have to say that after I started the carbamazepine, that was the first time I noticed significant reduction in symptoms. My headaches reduced in severity and became intermittent rather than constant. My hyperarousal decreased. The phantom smell mostly went away. And I was actually able to sleep for the first time in I don't know how many weeks. I was finally getting at least several hours of sleep. My hyperarousal decreased. Uh, I continued to experience tachycardia and an elevated pulse. But eventually my pneumonia resolved. And around week 9, I finally tested negative twice again for COVID, and I was finally able to return home from quarantine. So, and this is where this is where kind of the fun begins, right? Because I'm at the time I'm hoping that okay, I've gone through all these different things. My body's, I'm still here. I'm alive. I haven't had to go on a ventilator, so surely I'm going to be recovering from this thing soon. Um, but upon returning home, I began to experience increasing brain fog and fatigue, especially after physical or mental exertion. I started having some pretty bad joint and muscle pain. And it became so bad that just going up and down the stairs in my house was very painful. Around mid-July, so I was infected in March 2020, and diagnosed in early April 2020. So by mid-July, I finally had an EEG and no seizure activity was found. And since no activity was found, my neurologist decided, and I agreed that we should try to taper off of the carbamazepine. So at this point, I was pretty non-functional. The major symptoms at the time were brain fog, general cognitive difficulties, fatigue, agitation, insomnia, GI problems, palpitations, continued loss of taste and smell, eyesight and hearing problems, sinus problems, urinary problems, and a partridge in a pear tree. I mean, like my body was kind of a mess. About a month later, after I stopped the carbamazepine, I woke up in the middle of the night with this pooling sensation in the left side of my head that spread to the left side of my face and kind of across. I left a persistent feeling of burning and pins and needles. I wasn't able to get in contact with neurology, so I ended up going to the ER for evaluation. And the on-call neurologist suspected that it was paresthesia or dysesthesia brought on by inflammation. I continued to, and after this, I continued to feel as if my body was going haywire. Every day was pretty torturous, just because I never knew what to expect or how bad my symptoms would be. And you know, a symptom would be gone for a few days or even weeks, and sometimes it would just return stronger than before. My pain levels continued to increase through September. Most of my joints felt very painful. I also experienced this random inflammation. Like for example, different joints would just randomly swell up. Like I remember one night specifically where my left knee, I didn't do anything particular that day, just my left knee just completely blew up like a grapefruit, and I woke up in pretty excruciating pain. Um, but I mean, the pain stuff, all the physical symptoms, that really put a damper on my sleep. My headaches returned off of the carbamazepine, and I experienced a pretty intense throbbing pain on the left side of my head. Uh, the dysesthesia brought me constant discomfort and spread to the inside of my mouth and tongue. My mid-back pain worsened. I experienced near constant muscle pain and various other pains, like just random stuff. Like my scalp would become just like very like red and inflamed and irritated. Overall, I felt like really like a shell of my former self. Around this time, I was diagnosed with fibromyalgia by a rheumatologist, but they indicated they were unsure whether it's pure fibromyalgia or if there's a distinct COVID syndrome. Um, so, I mean, I could probably spend like an hour or even half a day talking about my whole experience and how this has gone for me. I just wanted to give you a snapshot of everything that's kind of led up to where I am now. So I ended up getting treatment probably around September that really changed the trajectory of my recovery. I started receiving frequency-specific microcurrent treatment and also acupuncture, and both of those treatments really changed. They brought they for the other than the carbamazepine, that was the first thing that really brought me true relief. I'll never forget after my first frequency specific microcurrent treatment, I felt almost as good as I did pre-COVID, which is pretty phenomenal. Now the results would usually only last a few days, but at least it brought me some sort of relief. So that was working out well, but as the cases increased, the COVID cases increased, I began to get concerned about exposure. So I decreased going to these appointments that were so helpful. And around November, I developed an uptick in GI symptoms, just a lot of GI pain, discomfort, constipation. It was just, and that seemed to kind of drive everything else. And that was pretty bad right up until I would say January, where I started a functional medicine program over at Fort Belvoir. So the functional medicine program, they kind of looked at the whole picture of me, and I did stuff like acupuncture, acupressure, different dietary modifications, this really whole person approach, and it really felt like it helped me a lot, as opposed to seeing a provider, a specialty provider who I talked to for maybe 15 minutes. I was actually able to sit down and discuss all my problems with the provider for an hour and sometimes more, just so they can get a sense of what was going on with me. And just having somebody listen and understand what I was going through was very helpful. Just as you all are listening to me now talk about my story is also very helpful. I know I only have a couple of minute or two left here. The other thing I want to mention that I feel like has really had an impact on my pain is what's going on and what has been going on socially. All the social stress that is kind of going on in our world right now, I believe is having, a considerable impact on my pain. There's a lot of, divisiveness, just a lot of political stuff that, when you think about COVID and everything that I've been through and how the world, I have family members who still to this day refuse to wear masks or get vaccinated and all those things, and it's tough. It can really be disheartening and this more demoralizing, and so that's definitely taken a toll on my recovery. But overall, now I feel like I'm in a good place, medication wise, treatment wise. Thankfully, stress wise, with all the COVID numbers going down, I feel like I'm in a better place. I still do have quite a bit of pain. It's mostly regulated to my joints. I am still struggling with mid and lower back stuff, but overall, I feel that I am getting better. Um, so I just want to thank you all for your time, for listening to my story. And if you come across anybody who's had COVID, just if you take nothing else, just remember that it's helpful for us to be listened to have somebody who can listen and hear us and understand us through our experiences. So thank you very much.